Hello, once again. Good afternoon, everyone. You're warmly welcome to Family Time today. My name is Shola Omolade Adeleye. And how has your week been? How is your family, wherever in the world you're connecting from? This is Family Time, a program that comes on here on Sundays, looking into the mirror of God's Word to see ways we can constantly improve the way we relate in our families. And this program, for those joining for the first time, is brought to you by House of Cedar. House of Cedar is a ministry with a passion, with a vision to inspire and to empower young people and their families to maximize their potential and to fulfill their God-given purposes. So on this program, we'll come up with different topics that impact our families, and we want to see ways that we can constantly improve the way we relate in the family. And please let us know where you are connecting us from today on this program so I can acknowledge you. But on this special edition of Family Time today, we have a guest. It's a guest speaker series. And then we have on set today a guest for this program, Dr. David Owoeye, joining us all the way from Nigeria. And he will today be sharing with us about the sickle cell awareness and how we as family members can actually support those living with sickle cell and how we can actually continue to help promote this awareness so that we can change some of the misinformation that we have about this, about the sickle cell anemia, and ways that we can actually bring out the best of those that we know living with this disease. Please feel free to welcome to invite others to join and also to share this video as we bring an awareness to the world where we are. I am joining you live from Maryland, United States, and greetings from my family here in US as well. And I'm going to bring on set our guest for today is yes. I welcome you.
Hello.
Thank you so much for joining us today, Dr. David Owoeye, joining us all the way from Nigeria today on this special edition of Family Time. For those that are joining for the first time, feel free to let us know where you are connecting us from so we can acknowledge you on this program today. And once again, my name is Shola Omolade, hosting on this program, Family Time. So, while we wait for others to join us, I mentioned earlier when we were doing the intro, the guest here, I'm going to say just a little thing about him based on this. I have a copy of his book that he published, and you can have access to it all over the world. I got this copy of mine. I'm based here in the US, he's in Nigeria. I got this from Amazon. And I'm sure there are other platforms across the world that you could actually get copies of his book. Very educative, a lot of information packed in there that would help us, to support our loved ones that are living with sickle cell anemia. So I'm just going to also start by, reading, a little of his bio from his book that I have a copy of with me here in Maryland. And it says, I read earlier for those that are just joining because I know earlier was just an intro. And I'm just going to read the bio once again that David Owoeye is a sickle cell warrior who passionately shares his experience of sickle cell crisis, complications, and other challenges to help other sickle cell warriors. This is done so that they are given, they are caregivers, families, their health providers, and other caregivers, and the public through awareness can know how to go about helping them. Also, to improve the care and to encourage more research on sickle cell disorder. So I'm just going to say a little bit more about as we go on, but I'm going to invite him to talk to us a little bit more about himself before. I don't want to read too much. Like, you can hear from the horse's mouth. So I'm going to welcome you once again. Thank you so much for making our time to join us all the way from Nigeria today, Dr. David Owoeye. Please feel free to tell us a little bit more about yourself and also to welcome our audience as they join us today on this edition of Family Time.
Yeah, good evening or good night from Nigeria. This is like 9 p.m. Thank you very much, Mrs. Shola Omolade Adeleye. I am David Owoeye. I'm a medical doctor. I specialize in infection prevention and control. I work in Saudi Arabia with the Ministry of Health under the Directorate of Infection Prevention and Control in the region of Gizan. I'm a sickle cell warrior. I have hemoglobin, sickle cell anemia, which is hemoglobin SS. And I use my medical knowledge and experience of sickle cell disorder to eradicate the myths, misconception, and misinformation about it in the public space. to also improve the knowledge and care of it, to encourage more research and studies into sickle cell disorder because there is little information. The information in the public space, both in the medical community and in the public, is not sufficient enough because it is from our experiences we started realizing that there are certain things that sickle cell disorder causes that was not written in the books. For instance, how many people do know that bedwetting, sickle cell disorder causes bedwetting? And I was bedwetting till I was more than 10 years old. How many people know that sickle cell disorder causes pica, whereby you eat inordinate object? I was eating sand till about 18 years or more than. So these are some of the things that our experiences showed, and in the information were not there in the past. So one of the things I want to do is to encourage more research and study so that we can be able to know the connection between most of these problems that sickle cell disorder causes and how to manage it. And then I also use my story by informing and inspiring the world to ensure that I give hope to the hopeless. So that's just a brief about me. I am married. I have two children. I'm Owoeye, two handsome boys. They're in Nigeria, and I'm a Christian. And I believe that whatever condition we go through in life, God is using us to prepare for a bigger purpose, a greater purpose, so that our lives will bring glory to Him. I was praying to God while I was young. I prayed, fasted, went for deliverance sessions that God should heal me and deliver me from sickle cell disorder. While I was a teenager, God then told me that He was not going to heal me, but He's going to use sickle cell disorder to glorify His name in my life. And I was like, wow, what does that mean? Because for me back then, in the past, in this period, when people go for crusades and they are healed, that's why I thought meant about glorifying God's name. But God used God made me understand. I used my experience to inspire hope in people. When you hear what sickle cell disorder is and you are informed, there could be a reason to be despondent. But I don't leave people in that state of despondency. I inspire hope in them. I make them understand that the presence of sickle cell disorder in me is not an absence, it's not the absence of God in me. I make them understand that by the grace of God, there are no limitations in life except for the limits you put in your mind. So that is
Awesome.
basically about me.
Awesome, awesome. Thank you so much for sharing that with us. I'm already inspired, just the first
Thank
question.
you.
And a lot of time, just like every other person, I also had a little bit of misinformation growing up. It be like anytime you see people that have sickle cell, you always feel sorry for them. You always feel that there's a limit. I mean, then getting to know you as a person, as a medical doctor, going against all odds, starting a family, so serving God with your gifts and your talents and inspiring people across the world. That inspired me. And I thought there's no better person to have on set today to share about this, sickle cell anemia that people suffer from across the world. Some people don't even talk about it. They are not bold enough to talk about it. They feel it's something that is like a stigma that they don't want to associate with. But I'm so happy that you're out there, not just only telling people, yes, I have it, but I'm going against all odds, to do life as God wants me to do. And I'm really, truly inspired. And I know others are also inspired. Please feel free to share this video so that you can invite other people to join us on this discussion today. I see people already online. And also, let us know where you're joining us from. Put in the comment section where you are joining us from so we can acknowledge you wherever in the world you are. And then I pray in the name of Jesus that this program will bring enlightenment to those that need it, bring healing to the heart of those that, going through it, and those that have family members that are also going through it. Back to my next question. So for those that do not yet know what sickle cell is all about, some are just hearing it for the first time now. I didn't get to hear about sickle cell until it was later on in my life, when it was getting to the time I was like, okay, I'm about to get married. And I just noticed that I had some loved ones that were just sick. I didn't understand things. So for those that are just joining us live today that don't know what sickle cell is all about, they don't know much about it, but they know that if somebody has sickle cell, they have SS, and that's all. So how do you want to give a brief awareness and a brief introduction? Tell us a little bit about this sickle cell anemia. How can somebody get it, as live with it? How can somebody prevent it if you are not here living with it, but you know people that are at risk of it? So tell us a little bit more about the sickle cell anemia and how people need to be more aware of it. And yes.
Yeah. Sickle cell disorder is an inherited genetic blood disorder. The problem is within the red blood cell. The red blood cell is the one that transports oxygen and other nutrients. So it's like the transport mechanism or the transport system for the body. And then once it is affected, it will hinder transportation. It will obstruct transportation, and then you should know that once transportation is hindered by carrying oxygen from one part of the body to the other, or nutrients from one part of the body to the other, there will be deprivation of oxygen and those nutrients where they are needed, and there will be problem. In the red blood cells, there is the Me and there is what we call hemoglobin. Hemoglobin is where the problem is. There is the Me and the globulin. I won't want to go so much into that, but it's in the globulin, one of the chains of the globulin that the problem is. I want to go much into that medical terminologies. So sickle cell disorder, as I said, is inherited. So it's only through um, offspring that you can have it when parents give birth to children. And I want to briefly describe it like this using the genotype ASAS. So when you hear both are not compatible, and this is the reason. Uh, for each pregnancy, because there's always this misconception that if you have 4 children, one out of the 4 children, no, it is not like that. It is for each pregnancy. For each pregnancy, there's a 25%
Probability.
probability. Don't forget, this is probability. There's a 25% probability that it will be SS, sickle cell anemia. There's a 25% probability that will be AS, sickle cell carrier or sickle cell trait. And then there's a 25% probability that it will be AA, which is the normal genotype. And then there's a 50% probability that it will be AS, which is sickle cell carrier or trait. Now, it could be fortunate for some people that, assuming they have 3 children, the probability falls on all the three children having AA, or it could be unlucky for some that all the 3 children have SS. I know families that all the children have SS. So probability is not something you can predict, and that is why genotypes that are not compatible are advised not to marry. When you don't marry, you don't give birth to children. So that is the best way to prevent it, and that is like the most authentic way to prevent it. People whose genotype are not compatible should not marry, so that they should not have offspring. Now that will prevent them having children that can have sickle cell disorder or sickle cell trait. Now, I call it sickle cell disorder because it is like a cascade, a complex that has different forms of diseases in it. There is sickle cell anemia, whereby it could be SS or SC. There is sickle cell trait, which is AS or AC. There is sickle cell plus thalassemia, and there are other variants. So that's why I call it a disorder, because there are other conditions, diseases that are associated with sickle cell together with it. Now, there are certain things that we call triggers in sickle cell and people with sickle cell anemia. And not only sickle cell anemia, because with time we got to observe that even people that have sickle cell traits do have some of those signs and symptoms. In the past, there was that misconception that people with sickle cell trait or sickle cell carriers don't have the problems, like the crisis, the complications. But we've seen that it is not true. When I published the book in 2020, a lady in the UK reached out to me. She's a sickle cell carrier, and she told me that everything I described in the book, she has experienced it before. Excuse me. She has experienced it before. So that was when I got to know that people with sickle cell trait also do experience the same crisis and complications you experience. Now, there are certain crises. One, there's the hemolytic crisis. Hemolytic crisis is frequent breakdown of the red blood cell. Remember, I said the red blood cell is the blood cell that is affected with sickle cell disorder. It is broken down frequently. That is hemolysis. Now, because of the structure, abnormal structure that the red blood cell forms when it's under certain conditions, it makes it becomes triggered for sickled in shape for those who have sickle cell disorder or sickle cell trait. So in that sickle cell shape, it is difficult for it to navigate or pass through the blood vessels, and then it can cause obstruction in the blood vessels. And then the cells, tissues, organs, and systems that depend upon the point where there is obstruction will be deprived of oxygen and other nutrients, and then pain and other problems that come from those areas. So because of the structure, abnormal structure it has, the lifespan of the normal red blood cell is 120 days. But for people with sickle cell disorder, the lifespan of the sickled red blood cell is within 20 days or at times 60 days. So it has a shorter lifespan. So it breaks down frequently. Secondly, there's an organ in the system called the spleen, which serves as the major organ for the immune function, immunity, whereby protecting the body against any form of infection or anything foreign. The spleen identifies this sickled red blood cell as abnormal and mops it up from the blood. removes it from the blood, and so gets enlarged. So that is another reason why there's reduced red blood cell for people who have sickle cell disorder compared to others. So when we go to check our hemoglobin or when we go to check our pack cell volume, we notice that our own stable hemoglobin is lower than what it is for other people that don't have sickle cell
Mm.
disorder. And then you could see that's why anemia is used to describe it. So that is one of the crises, immunity crisis. And then once it happens, it can make someone be admitted in the hospital and then be transfused with blood. There is also the pain crisis, which is the commonest. Pain in any part of the body, especially bony parts of the body, but can occur in any parts of the body. And then it triggers pain. One of the way I can describe a pain is the kind of pain a woman has when she's in labor.
Wow.
And then she's in active labor, whereby the cervix is more than 4 centimeter dilated. The head is almost at the pelvic region, and then she's pushing, having contractions more than at least 4 contractions within 10 minutes, and each contraction is lasting more than 2 minutes. That kind
Mm.
of excruciating pain that the woman goes that messes up her mind. That's the kind
Mm.
of pain that sickle cell disorder is. So we often tell people it is not just a physical pain, it's a physical pain that has a mental implication. Some people
Mm.
go into anxiety, some people go into depression, suicidal thoughts, nervous breakdown because the pain messes up their mind. I've heard of
Mm.
women who, when they're pregnant, doing labor, active labor, they were cursing their husband. And then if it is because of the way the pain messed up their mind. Because
Mm.
naturally and normally they will not do such things. So that is the same way it also affects us as sickle cell warriors. And then also like when someone has bone fracture, the kind of pain you experience when you have a bone fracture,
Mm.
that's the same kind of pain you experience. So at times we go to the hospital and present in the ER, and they don't see us shouting or wailing like those who are having bone fracture or somebody in labor. And because they don't see us shouting and wailing, they think we are faking it, or they think we are not
Mm.
having excruciating pain. But it's something we've learned to live with for a long time. I tell people that when you see somebody with sickle cell disease presenting with a pain crisis in the hospital, I want you to know that he has been battling that pain crisis for hours or sometimes days in the home. And then he has tried all things possible. And because nothing could prevent the pain, he has to come. So he's already exacerbated, he's already famished and exhausted, and doesn't is fatigued. He doesn't have strength in him. So he doesn't even have the strength to be shouting and wailing about the pain. So there's also the sequestration crisis. Remember, I mentioned the spleen, the main organ that serves for immunity. So, well, because of the frequent mopping up of the secret red blood cell by the spleen gets enlarged, what we call splenomegaly. So, in people with sickle cell disorder, especially as children, you will see when you palpate the left part of the abdomen, you will discover that the abdomen is protruded, like the abdomen end is distended because of the spleen is enlarged. That we
Mm.
call splenomegaly. And then after a while, it could get them to the hospital, admitted to the hospital because it could lead to what we call splenic crisis, whereby it results to severe pain and then frequent loss of blood. So after a while, this enlarged spleen becomes suddenly shrunken and becomes what we call go to what we call autosplenectomy, whereby it is removed. So for most people with sickle cell disorder, when you try to palpate for our spleen at the left side of the abdomen into the chest under the rib, you discover that the spleen is not there because it's as if it is already shrunken in size. It has
Mm.
gone to what we call autosplenectomy. So that's the third crisis. Another crisis which hardly does not occur again is aplastic anemia or aplastic crisis. This aplastic crisis is basically all the blood cells in the body are low or absent. The red blood cells which serves as the transport, the white blood cells which serves as the soldier cells, they fight anything that is foreign, be it germs, be it cancer. They're supposed to fight anything foreign body that comes to the body. And then the platelets, which serves as the uh, police that arrest bleeding. So all
Mm.
these blood cells are reduced. And so once they are reduced, their function is affected, and then complications will arise from there. So those are the commonest crises. There's also what we call acute chest syndrome, whereby somebody will present with difficulty in breathing, gasping
Mm.
for breath, and then we present to the hospital as if he has pneumonia. One of the easy ways to be able to find out is when they check the conjunctiva, they discover that the eye is yellow, thick yellow,
Yes.
or greenish. And then there are other tests they could do to know that this is not pneumonia, this is acute chest syndrome. And so those are the crises that are associated with sickle cell disorder. Then there are ways to prevent the crisis, which are one, because these are the things that could trigger the crisis. One, where is the dehydration? So that's why people with sickle cell disorder are always advised to take in more water, take in more food,
To
frequently.
stay
So our
hydrated.
requirement for fluid intake is higher than for normal people. There is also extremes of temperature when you're exposed to either hot or cold temperatures. What other people will describe as cold for them may be too cold for us. Or what we'll describe as cold for us may not be cold for that people. And what we'll describe as hot for us may not be hot for other people. So exposure to extremes of temperature can trigger the sickle cell crisis. Also, infection can trigger the sickle cell crisis. Any form of infection, COVID-19 infection,
Infection,
malaria,
exposure to
parasite,
cold.
yeah, malaria infection, any form of infection can trigger the pain crisis. And then stress can also trigger the pain crisis. Stress due to physical exhaustion or mental stress can also trigger the pain crisis. And then there are also other conditions that can result to stress that can trigger the pain crisis. A woman that menstruates, some women that have sickle cell disorder have mentioned that during their menstruation, they have sickle cell crisis. And then a lot of other conditions can trigger sickle cell crisis. And then hypoxia when there is reduced oxygen. So people that go on high altitude, they are easily exposed to sickle cell crisis because of the reduction in the oxygen level in the body. Then sickle cell disorder also causes some other complications, which because of time I will not be able to talk upon. But just look at it from every part of the body that blood supplies. Once there is a problem with the blood supply to that area,
To
problem
that area.
arises. Yeah. So in the head, there can be stroke
Yeah.
and then other conditions in the bone, avascular necrosis. In the eyes, it can cause retinopathy, disease of the retina. In the nose, it can cause epistaxis, profuse sudden nose bleeding. And then it can cause priapism in the penile organ, whereby there will be purposeless, painful penile erection. I've experienced it also before. And then it is very excruciating pain. And then it can cause many other forms of problems in the it can cause lower back pain, it can cause chronic fatigue symptoms, it can cause anxiety, depression, and many other. It can cause chronic leg ulcer as well. I've experienced chronic leg ulcer twice. So there are many complications that sickle cell disorder can
So
cause.
many. Wow. Awesome. Wow. Thank you so much for sharing that with us. So at least first we just want to, celebrate all the warriors going all the way out beyond their pains. Because with all that you've talked about right now, pain is associated with it in one way or the other. The crisis comes with pain, everything comes with pain. And so we just want to especially appreciate those that are living out there with the sickle cell disorder, disorder, I would say, and they are still living life to the fullest. Which takes me to my next question of being able to go beyond the pain. First, I will personally ask. So, what are the things that motivated you to say? A lot of time when you see people with sickle cell disease, and I would say disorder. Let me just correct that. Sickle cell disorder. I would say that. A lot of time people feel that there's a limit to how far they can go. Sometimes parents will like, oh, they don't want to sponsor them to go study, abroad or to do those kind of things because they just put limitations in their minds concerning them. But I just want to ask you personally, you're a medical doctor, you said you're married, doing life and being on board of so many other organizations supporting this movement. What has been your motivation to go beyond the pain to live life to the fullest? So beyond just being a warrior, you've gone beyond, to study both in Nigeria and even abroad as well. As I read from your book, and I know from your profile. So tell us what that thing is that motivates you to go beyond. So for those that are sickle cell, disorder currently, and they just feel that what's the essence, what's the point of me going far to fulfill my vision? They don't even see anything beyond where they are. How can you inspire them through your stories,
Okay.
to live
Okay.
life to the fullest? Yes.
Okay. No, when I said God told me that He was not going to heal me from it, He was going to use my life to glorify His name. And then He gave me a word. He gave me a phrase. There are no limitations in life except for the limits you form in your mind. And he allowed my experience in life to be able to prove it. While I was in medical school, I was into business. I won 2 business awards. I was also committed to our departmental fellowship, Nigerian Conference of Christian Medical Dental Students. The year I was the editor in chief, our newsletter, I was given the award of the best editor in chief nationally. And
Yes.
our newsletter was given the best in the country nationally that period, 2010, 2004, I guess. So there are a lot of things I was involved in, business and many other stuff in medical school, and yet my academics was doing well. So God used my experience to be able to prove that sincerely there are no limitations in life. That you have sickle cell disorder is not a limitation if you do not allow it in your mind to limit you. So I do go through crisis frequently. There are some times that I go through more than 12 crises in a year. Sometimes I go through like almost since 2019, 2020. Like it's like almost every day, every week I go through maybe 4 days or 5 days crisis, or some weeks every day of the week. But I don't allow this to limit me. When the crisis comes, I try and look for a comfort zone. I learned that through experience. That you look for a comfort zone while the crisis is going on. Once the crisis finishes, it will stop. It will go, and then you stand up and continue with life. So don't
Continue.
stay back.
Hmm.
Stand up, arise,
Wow.
and continue to make an impact in your life.
Hmm.
Uh, I want to say this. While I was working in Nigeria in a private hospital, I met somebody that is older than me with sickle cell disorder. I was like almost 6 or 7 years older than me. And then he came to the hospital. I was a doctor on call that day, and he was telling me, okay, he has sickle cell disorder, and that I was asking him questions. Okay, do you smoke? Do you drink? And he said yes, he smokes. He drinks, and then he humanizes. And he goes for party and all those stuff. He lives recklessly because we are told that as sickle cell disorder we don't live. He
Hmm.
was then 39 years old. That people with sickle cell disorder we don't live long. So what's the point? Let him just live recklessly so that if he dies, he dies. So after he finished speaking, I told him that, well, I also have sickle cell disorder,
Wow.
sickle cell anemia specifically, and I also suffer most of the things you suffer, probably even more. But I choose to use my life to make an impact. I
Hmm.
choose to use my life to make an impact. And I tell him the things I was doing as I was working there in that private hospital. I still work my normal job in particular in Nigeria HMO there. And I was also studying MBA in University of Ilorin. Then I was in Lagos. I do travel to University of Ilorin for my MBA course then. And I told him that even in my church, I'm an ESCO, I am the president of the Singles
Hmm.
Fellowship, that all these things I could just say, okay, because I have sickle cell disorder, let me not do anything.
Hmm.
But
Give
that's not what I'm going to
excuses.
do. I choose to make an impact in my life. So it's about a choice. Are you
Hmm.
going to let sickle cell make you a victim, or are you going to make yourself a victor with your story? So that is what I do. I want to inspire people. I want to inform people with my story. That what God gave me inspires me to do more, to do more. And one of the things at the back of my mind also is that I don't want other people to suffer the things I have suffered.
Hmm.
So when I tell people that, hey, when you see a child bedwetting and he has sickle cell disorder, it's not the child's fault. It is because of sickle cell disorder. I went through it. Those days, the shame, because medical information was not that much around then, back in those days compared to now. There are a lot of things that we're doing were not even effective. And everything we did, nothing was able to stop it because we didn't even know that was due to sickle cell disorder. And the shame, the depression that they could bring along as a child, that I survived it was even God. So I don't want
Hmm.
other people, other children to suffer those things. I don't want other people to suffer what chronic fatigue syndrome is, as I've been suffering for it for the past 7 years. And I tell people it's not an experience, it's suffering. I don't want another person to suffer chronic leg ulcer. I don't want other people to suffer chronic pain syndrome. Like 2 years ago, I was told that I had, by doing MRI and CT scan, my doctor said they spotted silent stroke. Silent stroke is asymptomatic stroke, no symptoms. Now, while I was growing up, what we were told is that the risk of stroke in sickle cell disorder only occurs in children. But now
Hmm.
I'm getting to understand from my experience that it's not only
Yes, you
limited to
are
children.
an adult.
So I don't want other people to suffer that. So I inspire
Hmm.
them, I inform them with my story so that others will not suffer the things I have suffered. And with God on my side, by the grace of God, I have been able
Hmm.
to do. In fact, it's without God, I can't do anything. It is because
Absolutely.
of the grace He has given me to do all
Absolutely.
that I do. And so I
Hmm.
give Him all the praise and all the glory. And I'll continue to do more as He inspires me to
Amen.
do it, as He enables me, as He empowers me to do it. In Jesus' name.
Amen.
Thank
Amen.
you.
Awesome. Awesome. Thank you so much for sharing that. That is so inspiring. And we join you. We give God glory for the amazing things. Indeed, we see His hand at work in you.
Thank
You
you.
know, when He says a thing concerning you, regardless of where you are, I hope this inspires others that whatever God says concerning you, even when medical condition actually try to dictate to how far your life can go, that God can take you beyond those points as long as you put your trust in Him. And honestly, I am just so overwhelmed and I'm just so grateful to God for your life, sir, for the amazing things that we know God is doing and is still going to continue to do in you. And so another question, simple question. A lot of time people feel they don't know. They just get married. I tell people ignorance is not an excuse. At what point should people find out what their genotype is? So that they don't get
Uh,
to the point of almost getting married and then they fix a date and they now find out. So at what
ideally, it
point?
should
Yes.
be. Ideally, it should be at birth. There is what we call neonatal screening, or even when people are giving, when they give birth to children, that is the ideal thing that should be done. There are some countries now that are advocating for neonatal screening, so that once a child is born, they screen the person for their genotype to know whether they are AS, SS, or whatever their genotype is. Now, but for those who have surpassed neonatal period, the first 28 days of life, uh, it is good to walk up to your hospital and go and check your genotype if you don't know about your genotype. But at another point, when people get to do it, before you get employed, when they request for test, you could do it. Before you go enter into school, college, it's better you start your academics. It is better you do it even right from primary school or pre-primary, because children experiences crisis as well, and then some of those things can affect their their studies. And so, if you don't know how to manage it, you may not be able to help them. So when you notice that, oh, the child is not coming to school frequently or stops coming to school for 2, 3 days, and then you know that, oh, because he has sickle cell disorder, you understand. I've heard of people with sickle cell disorder that had their exams in the hospital. So it's even while you're trying to start school, it's important you also do the test. Then at another point that could be done is do your antenatal clinic. And then at another point is before marriage, what we call prenatal genetic counseling. You let them do the test, and then you counsel them based on the result of the test. If their genotype are not compatible, you tell them they are not good for marriage. Sorry.
Yeah, that's fine. Yeah. I mean, that can be a very tough time. I mean, for those that maybe is getting to the point of getting married and they tell you are not comfortable, when your whole brain and everything is already, you are
Yeah.
already prepared for the journey. So the earlier, the better for us to find out. For those that are joining today, you're warmly welcome to Family Time. For those that are just joining, feel free to invite others as well. Today, we're just talking about sickle cell awareness, and we have on set today Dr. David Owoeye, who is a medical doctor and also, a sickle cell warrior, doing life to the fullest by the grace of God, impacting people from across the world. With his platform, with his books that he's written, he's written a book. I have a copy of the book here in Maryland with me, the book that talks about a life, with sickle cell anemia, to let you know that, what, some people don't, in fact, they're living life, they have everything at their disposal and they are not really doing as much. Sitting down to write a book, I've written 2 books already and I'm writing more. It's a lot of work that goes into a book being written. A lot of thought goes into it. For you to even think about it, for you to sit down and begin to put your thoughts down. So many people know, but they don't have nothing written somewhere that they can pass as knowledge to others. So we celebrate you for going the extra mile to particularly put pen on paper, to put a book out there where people can read, generations can read and get
Thank you.
knowledge about this to push their lives forward. So whether you're
Thank you.
joining on this program today, you're living with sickle cell anemia, or you know people that are living with the sickle cell disorder, or even if you don't know anyone yet, but you are not living your life to the fullest yet. Yet to give us an example, he gave us an example of somebody that met him at his hospital, and that person was living life recklessly, smoking, drinking, just humanizing and doing all kinds of things, and thinking that life someday will come to an end and he wants to enjoy life to the fullest. Your life is not only about yourself, but it's about the number of lives that you impacted with what you have. And the limits that you put on yourself is the greatest limitation that can prevent you from doing life, as he shared in his own story. So you do life to the fullest where God has placed you, because He has given us whatever it takes for us to excel wherever in the world we are today. And so back to my next question now. A lot of time, people that have sickle cell, there's a way we feel sorry for them. There's a way we, just like you say, people would think that they are acting the crisis. People feel that, there's a way. So how can you help us? I will say right now, how can you help us to support those living with sickle cell disease more positively? So we're not just feeling sorry for them, but we're providing them with the support that they need, the encouragement, the word of affirmation, the mentorship that they need to do life to the fullest. So how can we as family members support those living with sickle cell disorder, so as not to just be judgmental, so as not just to be feeling pity party for them? You don't need, I'm sure you don't need pity party. We don't,
Oh,
you don't need our pity party. Yes, well, maybe what you need right now, people go online and order copies of his books.
yeah.
Support him. Put the word out there about him so that at the end of the day, more people know what he's doing. He doesn't need a pity party. You don't need pity party. 100 other 100 copies of his book. That's what he needs right now. That's the way to help him. So how can you help us better to support those living with sickle cell and also to push the word of awareness out there more around the world where we are, so we can actually make more impact than just waste time. Yes. Oh, I have a wonderful cousin online today. He's Dr. Ye Shokoya. He's joining us from the US as well, too. He's a medical doctor. She's a medical doctor and also, a warrior doing amazing work here in the US as well, too. So please feel free, buy copies of his book, support the work. Very important. So share with us ways that we can support those, that are, living with sickle cell, and also not to just push them out there to encourage them to do life to the fullest.
Okay, as you said, we don't need pity. We don't want a pity party. That's not what we want. We want
Absolutely.
compassion. We want empathy. We want people that can listen. There are some things. One of the ways I try to put things we experience with about sickle cell is this: there are some things we go through that you can't explain to people. Like for instance, chronic fatigue syndrome. One of the things symptoms associated with it is this chronic fatigue that does not get relieved after resting. So you feeling tired, and then you go and sleep 2 hours, 3 hours, 4 hours, 5 hours, and you wake up weaker,
Hmm.
as if you just carry a bag of cement while sleeping. And you're telling the person, I'm weaker. So assuming you're supposed to go out with some people, and then you start feeling having chronic fatigue, it just comes suddenly. And then you tell them, give me 2, 3 hours to go and rest. And you go and rest, and then you wake up and you feel weaker. And you're telling them, I'm feeling weaker. I don't understand. There are things you can't even explain, because the people will be like, how can you say you are feeling weaker? You just slept now, and then you should be refreshed, but you're not refreshed. Then another problem with it is unrefreshing sleep. You could sleep for longer hours, but you not feel refreshed. So there are a lot of things about sickle cell disorder that we are getting to discover ourselves. So we need people that will listen, the medical
Hmm.
community that will listen. When I went to the hospital, I started experiencing chronic fatigue syndrome like almost 6 years now, 7 years. And then I didn't even know what it was. Before then, I've never heard about chronic fatigue syndrome. Even though I went to medical school, I practiced as a doctor, never heard about chronic fatigue syndrome. I've heard about chronic fatigue, but chronic fatigue syndrome, I've never heard about it. And I didn't even know that something like that occur. So I was seeing my doctor, and I was explaining some of the things I was experiencing, this chronic fatigue that I don't feel relief. And he was like, okay, okay, but they were not listening because they didn't really understand it themselves. These are hematologists, experts. I just
Hmm.
got to realize that there are only few among the pool of hematology that I had. There were only few that understood it. And in fact, at a particular one time, I met one that when I present, it also causes what we call a migraine-like headache, whereby the vein here will be pulsing. So that day, I had it for lasting for 72 hours, and it triggered pain crisis frequently. I exhausted all the medications I was using, nothing relieved it. So I went to the hospital to present after 72 hours, within that the 72 hour. And then I met the doctor that day. And the doctor said, yeah, he has heard about chronic fatigue syndrome, but he has never met somebody with sickle cell disorder that has it. That I'm the first person with sickle cell disorder that will be meeting with chronic fatigue syndrome. So there are many things about it that we get to experience that when you go to the medical textbook, you won't find it. You go to the medical journal, you won't find it. You go to the internet, you won't get information about it. And those things. So we need people that will listen. Then secondly, we do not need discrimination. We need to abolish, we need to stop every form of discrimination. Give everybody equal opportunity. I was given an opportunity to go to school. People did not say it is going to be a waste. My parents did not say sponsoring my education was going to be a waste. I've met families, educated families, that they did not allow their child with sickle cell disorder to go to school. They just allowed the child to go to primary or even secondary and then stop because they felt it was a waste of resources. A particular religious man told them that it is a waste of resources if you send a child to school. So we don't need that kind of discrimination. Let them have equal opportunities in the family. Let them be treated right. Let them be treated normal. Give them space. Let them develop at their own capacity and at their own pace. Do not discriminate. Do not stigmatize them. In the community, do not discriminate. In the academic institution, do not discriminate. Giving them opportunity to be able to thrive and be their best. And they understand that at times the crisis can come suddenly, even after you've tried all that you can. At times, you do all the things I've told us about how to prevent triggers, yet the crisis still
They still
comes.
come.
These are some of the things we are going to understand that. So after I've done all this, and then the do's and don'ts, and then I'm still having a crisis, what else can I do? So you have to understand that even after you've done all that they've told you to do, you can still have the crisis sometimes. So
Mm,
you have to show understanding and empathy, and not just blame them that it's as if you've done something wrong. Excuse me, he has not done something wrong. He has
mm,
ticked all the T's and dot all the I's. But the pain crisis also comes at times without notifying you. So those are part of the things. No
mm.
discrimination. Give everybody equal rights, equal opportunity to be their best. And I believe that when you give everybody equal opportunity to be their best, by the grace of God, everybody will contribute their quota to mankind and to make our life and our world better. Thank you.
Awesome. Thank you so much for that. I mean, we're going to be wrapping up soon. Thank you so much, Dr. Owoeye, for sharing with us today. And I'm just going to ask also, I know there are many people that inspired you along the way, like mentors, like your parents. They want to share with us those that actually empowered you, that actually encouraged you, motivated you along the way. A lot of time we have people, not very many people, around. I'm sure the percentage of people living with sickle cell disorder is not so much in some parts of the world. And a lot of time, you just have them here and there, and they don't have the support that they need. So, do you know of other organizations that can share with other families, that can help support them, where they can get mentors and those who cheer them up, those who encourage them as they go along there? I would say, a group of cheerleaders to let them know, what, it took me time for me to eventually discover you on Facebook, and I see that you're doing. I'm sure you didn't know I was following you and watching you over the years and seeing that you're doing things until one day, I think it was my birthday, you wished me happy birthday, and I reached out to you, and I'm like, okay, this person that is wishing me happy birthday, that means, okay, let me just reach out to him as well too. So how can do you know of platforms that can help support other people, that are, sickle cell warriors that want to do amazing things, but they just stood down, trying to downplay, due to limitations that people put on them, or even limitations that they put on themselves. So you want to share with us briefly how they can get support, mentorship, just connecting with people across the world that can help them, move forward as well.
Okay. Now, various countries, I know various countries have different sickle cell organizations, associations, or clubs. There is Bula Sickle Cell Foundation in Abuja, in Nigeria. There is Pearl Sickle Cell Foundation in Ilorin, in Kwara State, in Nigeria. There is SAMIS, Sickle Cell Advocacy and Management Initiative, in Lagos State in Nigeria. There is Amplify Sickle Cell Voices International. It's a global platform for sickle cell warriors. There's also a Global Association of Sickle Cell Disorder Organizations, GLASTO. So there are many organizations. If you check
Mm.
your online for your
Right.
country, you will see there are
Yeah.
sickle cell organizations or clubs that you could join. Then you could also visit your hospital. You could speak with your hematologist or your doctor. They will be able to link you up with sickle cell clubs that they know.
Mm.
Now, as I quickly want to say that it's very important in managing people with sickle cell disorder or in taking care of yourself to be part of a support group, the organizations, because when you hear other people's experiences, it motivates you, it
Mm.
inspires you. When you hear people talk about the challenges they are going through, you know that you are not alone. It was while I shared my experience about priapism online, and I saw many people reaching out to me that they've suffered from it, that they are suffering from it. What can they do? And people were like, "So this thing really exists." When I
Mm.
shared my experience about Pika, that I was eating sand till above 18 years, I saw many people also responding that they eat grass, they eat charcoal, and so people, and they said they didn't even know that it was due to sickle cell disorder, that they had sickle cell disorder. They didn't even know. So by being part of a support group where you share your experience, you inform others, and then you motivate them, you inspire them. There is this energy that it comes with it, whereby the belonging, the sense of belonging, keeps you comfortable that you are in a safe zone. And then some of these organizations have resources. They provide empowerment programs for those who don't have a job. They help them to be able to get a job or provide them with skill acquisition programs to empower them to be able to start a livelihood or start an entrepreneurship for themselves. So there are different things. And then some organizations also do free clinics whereby you have access to free medications, free consultation, and then they also give other resources, or they can connect you with hospitals that you could go for discounted prices, or some can also link you up with health insurance companies whereby you can purchase health insurance packages, or they can buy and give you free insurance packages. So it depends on what each organization is providing. And then they also provide platform for creating awareness and advocacy so you can participate and then be part of whatever they are doing to ensure that we advocate for sickle cell globally and locally.
Awesome. Thank you so much. Please feel free at the end of the program, please feel free to go just in the comment section to just include some of those organizations that people can see
Okay.
even after the broadcast, and they can, go visit those websites where they can get support as needed. And also, and I know you can get, for those that are joining also, you can get copies of his book on Amazon. I think, I don't know what other websites can they have access to your book apart from Amazon. I think we lost this connection. So I think you could get this, we'll also put that in the comment section for those that will still join at the end of the day. So I think we'll be wrapping up today's edition of Family Time. For those that are joining for the first time, this program comes on here on Sundays, looking into the Word of God and seeing ways we can constantly improve the way we relate in our families. We all have a role to play wherever in the world we are, whatever kind of family you are actually part of, whether you're still single, you're married, we all have a role we can play across the world that can make difference in the lives of people. So this platform just comes on here. We just share on different topics. Sometimes we bring it on here as well to guests that can come talk about different issues that affect families and see ways we can constantly support ourselves. Feel free to write in the comment section any of the questions that you have. I and myself and Dr. Owoeye will still have access to these comments so that we can respond as we need to as we go ahead. People that have not watched today can still join this broadcast because it is recorded on YouTube and also on Facebook. Feel free to share with others and also to make your comments or your questions so that we can all just join hands to support one another with the knowledge that we know. As a wrap up today, so what one last word, a parting word that you have for us today, Dr. Weye, on this platform, that will inspire not just the people that are the sickle cell warriors and also their families, their friends out there to just be the best, be the light wherever they are in the world, doing amazing things to the glory of God to impact other people. So what final words do you have for us today as we wrap up on this edition of Family Time today, looking at sickle cell awareness? Thank you, Dr. William. Yeah.
Okay. I'm going to demonstrate it briefly with an illustration. The parting word is this: know what works for you, know how it works for you, and make it work for you. Now, it is required that people with sickle cell disorder, we should drink more fluid frequently. Personally, as an individual, I don't like drinking water much, but I like sweet things. So how do I meet that requirement and still satisfy my craving for sweet things? I get a juice or a drink, a juice, and then I mix equal amount of water of the juice, equal amount of the juice with equal amount of water. So by that time I've diluted it, I can still preserve the sweet taste and meet the requirement of drinking more fluid frequently. So
Mm,
I know that is what I see works for me to be able to meet the requirement of more fluid intake. So knowing what works for you in life, knowing how it works for you, and then make it work for you.
make it work for you. Absolutely. Awesome. Thank you so much. And thanks especially also to your family for creating the time for also have you online today, your wife and your children, there to support you. Thank you so much for your time today. I don't know if you have any questions. Anybody in the audience, you have a question for Dr. Weye, please feel free to just put in the chat so we could share that now before we wrap up, or maybe afterwards to just share those questions as we wrap up today. Sickle cell is not, something that is sickle cell disorder is not something to be ashamed of. If you have a child that have it, don't look down on that child. Support the child. Don't discriminate or stigmatize that child. If every child of yours you want, like he went abroad to study, I think you read in your profile that you went, I think he studied in the UK or somewhere. People invest in their lives and let them become as much as God wants them to be, and don't put limits on them because they really want to. They want to be heard. They deserve to be heard. They deserve to be loved. They deserve to be cared for. Some people would discriminate. They don't want to marry somebody because they have sickle cell disease. No, I'm sure you've been married for a little while now. Your wife is there to support you. Your children are there. You're seeing them. You're happy. So don't let us discriminate. If you find somebody that you like, whether it's male or female, and you want them, don't leave them because you think they have sickle cell disease and their lives are limited because of that. Let us show them love. Let us show them care. Let us show them respect. Let us treat them the way we want to be treated because they're human beings that needs our respect. Because they have sickle cell disorder doesn't mean their brains function less. He's a medical doctor. That's a field that demands a lot of reading, a lot of brain work. I don't think I can become a medical doctor. I'm smart, but it takes a
You
lot
can
of
do
work
it.
and super people that can read extra to study medicine, just like I have also Dr. Ye joining us, also a medical doctor. And so when you see them doing amazing things, celebrate them, appreciate them, love on them, empathize, and just give them all the cheer that they need to become who God has called them to be, because they are very intelligent. Yes, most of the doctors are intelligent people. They want to help. You can't be a medical doctor if you are not compassionate. So when I see medical doctors doing amazing things, guess what? They are very compassionate people. So we celebrate you, sickle cell, warriors doing amazing things. I celebrate you, Dr. Way. I celebrate my wonderful coaches joining us today, Dr. Ye, Shokoye as well. To God bless you. Thank you so much. We love you. We appreciate you for the
Thank you,
amazing things
everybody.
you're
I
doing.
appreciate
And
you
I
all.
pray that God will continue to strengthen you. God will continue to keep you for your family, continue to bless you and prosper the works of your hands. In Jesus'
Amen.
name. I thank you so much for everyone joining today.
Amen.
Feel free to like and to share this video so that other people can get more awareness, to let you know that sickle cell, people who living with sickle cell are doing amazing things out there. We can support them and help them become who God has called them to be. I think that's about all we can take on this edition of Family Time today. A lot of time when we have guests, we usually have extra time so we can have them share their stories and also inspire other people. So thank you so much for joining us today from Canada. I see my sister here as well too, Yetunde Daudu. Thank you for joining all the way from Nigeria, from US, from Canada. Thank you so much for joining us today. We look forward to having you same time next week on this edition of Family Time. Every weekend there's always a topic to share, so feel free to join us next time on this program, Family Time. And go ahead please and order copies of his book. Buy for yourself, buy for other people, so that you can know what they go through and find ways that you can support them. Ignorance is not an excuse to look down on people, no, but once you know what people are going through, you find better ways to support them. And we will continue to do this as God gives us grace and strength, in Jesus' name. Thank you so much for everyone.
Thank you
God
very
bless
much.
you. Have a great rest of your week. My name
Thank
remains
you,
Shola
ma.
Omolade Adeleye, and I wish you a very wonderful week ahead. Thank you so much. Thank you, and have a wonderful day, everyone. Thank you so much for joining. Yes.
Thank you.
Bye for now. Thank you so much, Dr.
Bye.
Way. Have a blessed week.
Thank you, ma.
All right. Thank you.
Enjoy the rest of your day.
And you too. Regards to your family. Bye.
Thanks. Bye.